So what is telehealth? Telehealth is the provision of healthcare remotely by means of telecommunication technology. So telehealth is, over the phone or over your device, your computer, to go and get communication or diagnosis through technology. So the objective here is to show you the assistance that telehealth can help with, and to show you how you can use these to go to the doctor, like a doctor's appointment. You could use it as a means to pick up your prescription without physically picking it up, or even a checkup if you feel something was off without leaving the comfort of your home. So some of these resources, uh, MedExpress, UPMC, CVS, WebMD. I mean, there's far more, but these are some that you may know of or may heard of that participate in these telehealth opportunities. So even CVS, like that some people use CVS as their pharmacy, maybe. Walmart, things like that. You can go or have your prescription sometimes delivered to you because recently we've seen now grocery stores are using things like curbside pickup, so you could drive to the curb and pick it up. Now, even a step further, some places are using these resources to get it delivered to your house. So now not only can you get it curbside and you can pick it up without leaving your car, now we can have it delivered without even leaving our house. Uh, and then that really brings us to the convenience, travel and the comfort. When using these telehealth resources, it can allow you to, you know, not have to go out. And some people may not want to, if, maybe you don't like to drive anymore, or don't have a car to drive now. You don't have to go anywhere. You don't have to have somebody wait on you to pick you up or wait for the bus or stuff like that. So now, when we talk about scheduling appointments, this will can be done completely online as well. Some without even calling. You can schedule the appointment without even having to make a phone call. So when scheduling these appointments, you'll Google a telehealth resource. So you can actually Google or just look up online a telehealth resource, and you will see some links that look similar to, like, Swift Checkup was one of the first couple links I saw there. But like I mentioned before, WebMD, UPMC, Allegheny Health Network, I know, does that, AA10. So if you're primary care already offers this, you can go straight through your provider, your primary care, and go ahead and do telehealth or a remote visit. If not, you can look at some of these other resources, and after, when you click this, you can easily set up an appointment. It will ask you when you would like to schedule an appointment, and there will also be some resources that offer you to check if your insurance will cover it or not. So you can actually get your remote consultation covered through insurance. So not only will it be more convenient for you, but you may not have to pay. But side note that some of these telehealth resources do make you pay the copay, or will offer you to not go through your insurance. So it's not on record with your insurance company, and you could just pay the deductible. So, like WebMD, this is just around this area. I gave it a quick search to see what would pop up around here. And this is what if you were on your mobile phone and looked it up, this is what would appear. So just throwing this doctor out there that says that they have 16 years experience, but they don't have any rating. I mean, I may not, I'm not here to talk about the doctor or not, but what you can do here is put your zip code in. So around here, I put near Aliquippa, PA, and it says 15001. This is showing me people around. Now, that's Cleveland, Ohio, but mind you, these would be remote visits. So we don't have to really focus that hard on how close or far they are, but you can scroll down and you can pick the doctor you want. It's not like you have one person to choose from. You can actually go through and see who best fits your preferences for a doctor that you would like to visit or go over your issues with you remotely. Another thing that is incorporated with telehealth is remote monitoring devices. So this is a picture of a few, just a slim amount of remote monitoring devices that they're a part of telehealth because they send data about your health to your doctor while you're actively living. Like now, someone who uses one of these or has one understands what we're talking about necessarily, but this is a part of telehealth because it's constantly taking data, taking data about your health, to ensure that you are still in good standing. Um, so that is why it's incorporated with telehealth, just because it is constantly monitoring you remotely, on the go, and sending that to your doctor, uh, so we can ensure you are still okay. Um, we touched on it a bit earlier with the curbside pickup, but prescriptions. When ordering prescriptions, you can do this with your normal pharmacy. Mine is Giant Eagle, CVS, Rite Aid, Walmart, all of these places that offer pharmaceuticals, or they're your local pharmacy. You can do this by going to that local pharmacy's website and using an option. They may have an option called curbside pickup, or uh, they can, like Walmart, I know sometimes can actually deliver it to your house. Now, the thing that may be on the fence about these are they are prescriptions, so they may need you to pick them up curbside just so they know that it's you. But so I don't necessarily get them like my prescriptions shipped to my house, but I do go right and drive through. So it's really, discretion. Um, Now, when we want to get into the telehealth visit and we book our appointment with the doctor we like, and that appointment's in a week or so, however long. Whenever we're preparing for your visit, what we want to do is we want to have a good idea of everything we need to talk to that doctor about. So, you know, what, concerns obviously made you schedule this appointment? Why did you have to schedule it? In questions you also think of down the line between the time you book your appointment and the time you go in for your appointment. Don't forget, you're allowed to bring notes to your appointment. It's a virtual appointment. I mean, you're allowed notes at any appointment anyway, but write down what would be bothering you, or in certain instances or scenarios, that you might not remember. Even me, I go in for the checkup and I had something bothering me, my shoulder, or this and that. And then I get there and all of a sudden I forget what was bothering me. So it never hurts to bring a little piece of paper with some jotted notes down, just on what was bothering you, what was the reason for the appointment, and also prescriptions you take, prior appointments you may have had, allergies if you're allergic to anything, even down to dye. I mean, if you're getting a CAT scan, like, um, and ongoing health related issues, things like that. Just if you're on any medication or had any complications in the past. You want your doctor to be aware of all these things, especially if it's a new doctor via telehealth. You want them to understand where you're coming from, where you are at right now. So helplines for telehealth. If you look up, if you Google helplines for telehealth, there's one for Pittsburgh. There's a link in this uh, slideshow. But these resources are 24/7. The helplines, they can be called at any time in case you may need to speak to a doctor now. But to keep in mind, this is not an emergency services like 911. This would not be if you think, something is seriously wrong and you need to get to a hospital. This is not what I'm talking about. This would be maybe a concern that you want to speak with someone within the week or a couple days, or want an opinion, a professional opinion on something. That would be a time to call a telehealth helpline, not an emergency situation. Now, this is just going over the role of like what I do as the digital coach. While, yes, we can't get everything covered over a small webinar, but we can answer more questions if you come down to see me, or you can schedule appointments with us as well. So really what we want to help you do is understand these resources that we have these webinars and trainings for. Uh, we know that these are just broad sometimes, but we want to help you understand fully what we are elaborating on in these webinars. And if there are other questions, we enjoy having you ask these. So really, we just want you to understand, and this was to help you understand how to search for these resources. So opening the computer and what you can look for, not to be startled by these links, really, for telehealth. And then now I'm open for any questions. If anybody has any questions now with us that I could answer, now would be a good time.
I have one question for you. When you're kind of going through that WebMD list of doctors, are there things that you're looking for that kind of help you like jump out, like the reviews or anything like that?
Yeah, so like I mentioned, that small screenshot was just around here, but even if maybe let's see, I'll go back here because there was something I'll mention because uh, when you're looking at the well, okay, I won't go all the way back, but when we were looking at, you'll see there's stars, where you rate or review the doctor. And if you noticed on that first one, there was no stars. There was no, it said zero reviews, there was zero rating stars. I probably wouldn't go with that doctor because why would, a good doctor have no reviews from any patients that he's worked with in the past at all. So that one probably wouldn't go to. But you can see just scrolling through these reviews. You want to find a doctor that uh, you like. They will show a picture of the doctor. There should be a description of the doctor you would like to see, uh, and a little bit about them. The thing with the WebMD is that I liked was it's not very blind. Like they will tell you the details you want. Uh, if they're a good doctor, they give that information, and you'll be able to tell the difference between someone who is legitimately good on WebMD and maybe someone who it's just not even real, kind of. But you know that's kind of another thing, something just in the whole digital world as a whole is when they give us something that's convenient, there's always those others that try to take advantage of it, so that it's hard, online sometimes to distinguish the difference, but you know and nothing's easy, I guess, to just to put it that way, but
No, definitely. I think that's, good advice, knowing that there's a lot of options out there, but that means you might have to put in a little bit more work just to make sure you're finding what's best fit for you.
yeah, and take your time. It's not a rush. You don't have to find a doctor, necessarily in the first click of a button. You're allowed to scroll through and take your time, and even look online with, um, you know, brothers, sisters, children, you're allowed to have multiple eyes. Even you could come to a digital coach and say, I don't know if this is legitimate or not, and we can give you our opinion on it. Just it never hurts to have more eyes on it, and don't be afraid to ask for help. Okay, and that leads me really to this quote I put up here by Albert Einstein: is knowledge is experience. Everything else is just information. Okay, so in a sense, he's saying, we can tell you all kinds of information. I could read you the dictionary, but you have to experience you have to experience something to understand and know it. You learn from experience, whether you like it or whether someone likes it or not. I believe that you truly learn from experience, and practice makes perfect. So don't be afraid to ask for help. You have to go through the experiences, and maybe failing or messing up one time, messing up the searches a few times. That's okay. uh you know Knowledge, like he said, knowledge is experience. So, yeah, that's the webinar I got for you guys today on telehealth. And any more questions, I'd be glad to answer. And we have online, uh, the libraries we are in Erie and Beaver County, and so don't be afraid to stop in.
Yeah, definitely glad that you glad that you guys could watch this webinar. We hope that you learned a lot. Again, feel free to rewatch these on our YouTube channel. Check out our other webinars. Go to our website, tech2elevate.org with the number 2. But overall, we're just really glad that you could join us. If you need help up in Erie, Beaver, or remote, feel free to contact us, and have a great day. Thank you.
Thanks.